Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Steve Lang, President and CEO of Denker, a U.S. company that designs office space. They discuss how the office will be forever changed by COVID-19, including how spaces will need to be reconfigured so that people will feel safe going back to the office. Let's listen.
Steve Lang, thanks so much for joining me.
Thank you very much for having me.
So tell me a little bit about what your business does and how things have changed during the COVID pandemic.
So we provide commercial interior fit-out work for large corporations, healthcare, and educational institutional clients. Needless to say, it has changed quite a bit with this pandemic.
Mm-hmm. In what ways?
There's really three ways. For me, first is how do we and our clients help people feel safe and stay safe as they contemplate migrating back to work? And at some point, we will do that. The second area for me is how do we properly allow work to continue? You know, this pandemic is with us and it's going to be with us for some time. And who knows, maybe there's one in the future. So what can we do to allow work to continue in a productive way? And then longer term for me, how do we better prepare for any kind of a resurgence or what the office will look like, the workplace will look like in the future? So those are three key areas where I've been spending a lot of time with our clients and with our own employees.
What are you hearing from your clients? I mean, I know, for example, I'm working at home right now, and I know you are as well. Our offices have been sitting vacant for a while, and I don't know that I see a prospect of returning to my office for a while. So, what will that look like when I go back?
I've spent the last 2 months doing client roundtables, and we did some surveys with clients. And I think the most important thing that businesses, organizations need to consider is if we don't solve for the basic human needs of safety and security and health and wellness, we have no shot at doing good work back in the office or even in this remote environment that we're all working in. So if you think of that Maslow's hierarchy of needs, ultimately we want to do things with work to be aspirational and to achieve and accomplish goals within an organization. But none of that work will get done unless we solve for those basic health and wellness needs. Now, we're solving for them temporarily by distancing folks and letting everybody work from home. But that's not a long-term solution. And I don't necessarily think waiting for a vaccine is the answer. And so that's where we're engaged with clients to try to define what that looks like and how we safely return people to work.
What is sort of an example or two of what that would look like?
So there's a couple. When you define work, you can't necessarily define work by what you do or necessarily where you do it, but how do you need to work? And can you establish a level of choice and control? So to me, it's not necessarily an or. I need to work from home or from the office. It's an and. I can work in both places. And if we define work more around how we need to do things, it begins to use the office or think of the workplace as a different environment, perhaps maybe a club that we can go to. There are less people in the office, and there certainly will be. I know some organizations are starting to migrate back in that 10 to 15 to 25% range. But you'll see significant distancing protocols. We work on the interiors of space. So, things like privacy screens, clear glass, measuring temperatures on the way in. I mean, all these things, all these new protocols are going to be really important. The other quick thing that was on my mind was the perception of clean versus clean. And so I can say that this building has been clean, or, this room or your desk has been clean. But unless I see it happening, there's some psychology behind, oh, I want to know that it happened. I don't want someone to tell me that happened. We've kind of violated this crisis has violated trust. It's no one's fault, but I don't trust that where I'm going is a safe place. So I trust that my home is safe, and that's where I'm going to be right now. So simple things, cleaning protocols, but also putting the cleaning in the hands of the employees. So at least at some level, they can feel that they have the ability to choose and control their own space and their own environment and make it something that is acceptable to them.
And when you say put the cleaning in the hands of the employee, sort of providing them with cleaning supplies at their station, things like that.
Yep, for sure.
And I also imagine, I sort of see the future of work in my mind is I would come to the office only when I really need to collaborate with others, right?
Yes.
And so will these things visually look a lot different?
Well, they have to look different. There's been a trend even before this pandemic to densify. Let's just use the office as an example. We do healthcare and education, but the office, the primary place where people work. There's been a trend as in the teens to really create some density and have these open plan workstations, almost hot desking or desking. And we're really cramming people into this very open plan. And the theory was that they would be able to collaborate more and they would be more engaged with their employees. And while some of that's true, there's also a side problem. And that is that there isn't a level of privacy. You don't feel that you're in a place that you can do some heads down work. And so what we're starting to see even before the pandemic is how do we provide a range of settings for employees? Some heads down work, some open team collaborative space, some small little enclave or private space to have a private meeting, and then a group training area. And so the space has been thought more as a community rather than this is my workspace. And I think that trend is going to continue. And I think you're going to see, because of the 6-foot distancing and because of this social problem, the office is going to change quite a bit. And you're going to eliminate that idea of that desking system where everyone's lined up. That's going to go away. It's just too close. People are too in tight quarters. And the workplace will be one place that work gets done. And, like transportation, there are plenty of ways to go somewhere. There are plenty of places to do your work. So there isn't one right place. It depends on what work you're doing.
This sounds to me as though we will have fewer people in the office at the same time.
No doubt.
And it sounds to me that there's going to be a lot of people who primarily work from home going forward. That's got to be something a little scary for someone in a business like yours.
It is.
Do you see it the way that I just described?
I do and I don't. Humans are social creatures. And, more than half of the people that we surveyed, said that they don't feel connected working from home. It's good enough. But if you're an organization and you're trying to ultimately leverage business results and get your people and your culture to be an asset, the physical place is an artifact of that asset, of that intangible asset. And it creates culture, it helps reinforce culture, and it enforces or reinforces good collaborative teamwork. And humans are humans, and they have to collaborate. There's, 80%, I think the number was north of 80%. This was a global workplace study recent because of the work from home. People don't have adequate work from home solutions. You and I are relatively fortunate. I have a home office and you have a place. But, what if you had young children and they were climbing on your lap in the middle of your kitchen and you're trying to get work done? It's hard.
And that is the situation for a lot of people right now. Schools are likely to be online in many places come fall. I guess that's one of the reasons that people eventually will need to go back to the office.
No doubt. Yeah, no doubt.
So do you think, and I guess the idea is you need people to feel like they want to go back to the office, and you have to make changes that really assist with that.
Yep. Yeah, I said earlier, think of the future of the workplace like a club or a place that you want to go, a destination where some of your best work can be done. If I'm doing a report and I need some heads down time or some research time, I don't need to do that around a group of people. I don't need to do that in this highly collaborative and dense environment. I can do that at home. I can do that at a library. I can do that wherever I need to do it. But think of the workplace of the future as a destination, a place where you want to go, a place where all the accoutrements of really good, effective meetings, really good, effective collaboration are there. And the workplace is going to need to accommodate the fact that there will always be a certain percentage of the workforce that is not in the office. And so things like telepresence and teleconferencing, if I had a teleconference, and I'm in a really dense open environment, even if the folks from home are on the teleconference, I'm still sitting next to 12 people and they're hearing at least half the conversation if I have a headset on. So the office is going to have to migrate. Yes, there's going to be distancing protocols just because, but also more of a place where good collaborative work is done. A lot of the other services, food and training and development, and all those places will be very much the office, the space where people work will need to be a draw. It will need to be a destination.
And I also feel as though you're going to need to see a change in philosophy from some employers. I mean, there are some employers who feel like their employees don't get the work done at home. Or it certainly isn't to the quality. So there's going to have to be, you talked about the word trust. There's going to have to be a sort of a new trust coming from the top, don't you think?
Yeah, it's a little bit of a generational, I hate to put that label on it, but it's a little bit of a generational thought in that, if you're not here and I can't see you, perhaps you're not working. And I think, that from a U.S. economy or U.S. business perspective, I think we're growing out of that. I need to see you doing your work. But, listen, this on the same token, people that are working remotely all the time, even before this crisis, didn't feel as connected, weren't as readily available to be considered for a promotion or for some new assignment. They didn't feel as connected as perhaps the people that were in the office. And that was way before the pandemic. So I think that continues, and I think there'll be new and innovative ways to allow us to do that work wherever, but still feel connected. I still get back to I think of sports teams and place. And, could we play a basketball game on a dirt court? Yeah, sure we could. It's good enough. But don't we want the best equipment? Don't we want the best sneakers and the best opportunity to do our best work? And competitive business and clients, certainly our clients, are talking about, what is that competitive edge and how do we do a better job? And those are things where I don't think the power of place is going to go away.
Well, Steve Lang, thank you so much for taking the time. This was great.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.